This is a quick tutorial, guys, on how you use Open AI on your desktop, your laptop, whether you have a Google or a Microsoft or an Apple account. It's very easy to sign up and get started with what's known as ChatGPT, and it's version 3.5 currently, which is free. So when you first go to openai.com, you just type in openai.com on any web browser and it will take you to log in. Once you log in, this is what you'll see, and it's very simple, very easy. And then it asks you, how can I help? And I'm going to go over real quick the Medicare conversation I had, and it even titles it Medicare Questions Assistance. That's how smart OpenAI is and how smart ChatGPT is. And so let's get right into it. I ask OpenAI, hey, can you help me with a Medicare question that I have? And it responds, of course, I'll do my best to help. What's your Medicare question? How can I find out when my initial enrollment period will be? And so I don't have the best English on this, but it obviously tells me the answer that I need and the answer that is specific to my Medicare question. It tells me, the first 3 months before my 65th birth month, the month of my 65th birth month, the 3 months after my 65th birth month. That is known as IEP, initial enrollment period. And it even goes on to give me the Social Security Administration information and phone number to call to speak with a live person about enrolling into Medicare. You can't do it over the phone because that is a security risk. You can enroll into Medicare Part A and B, which is the first step of the process, either through your My SSA online account, or you can do it via face-to-face, setting an appointment at your local Social Security Administration office. But you can get more information and clarification when calling the customer service number at 1-800-772-1213 at Social Security Administration. That's how to enroll into Medicare Part A and B, and that's the very first step in the process of enrolling into Medicare. And so again, this customer service tool is great, not only for Medicare but other things, and we'll get into that. But the second question I asked was, can you tell me the pros and cons for Medicare Advantage? And so it says, certainly, Medicare Advantage, also known as Medicare Part C, is an alternative, remember that's a key word, to original Medicare Part A and Part B, and it is offered by private insurance companies. Here are some of the pros and cons for Medicare Advantage. So let's go over some of the pros and cons. Let's see if they are pros and cons. Okay, all-in-one coverage. Yeah, it's very easy to identify with one ID card. Out-of-pocket maximum, in my opinion, a max out-of-pocket in many cases, especially if it's a very high limit, is not a pro. In my opinion, say a max out-of-pocket of $11,000 when you're in critical condition, or max out-of-pocket when you're out of network, or if you are not covered out of network. You won't even have a max out-of-pocket. So max out-of-pocket has some degree of interpretation, and you would need to know that and discuss that with someone who you know, like, and trust as a Medicare specialist. Okay, simplified billing. Yeah, it's simplified billing when there's zero premium on top of the Medicare Part B. So Medicare Advantage, I'll get into this question more about Medicare billing, as well as the trends that is about to happen with Medicare, and the premiums, how those are going to increase in the future. So make sure to hit that subscribe button if you want to know more information about Medicare Advantage premiums and how they may go up in the future. Coordination of care. Yes, coordination of care. Many Medicare Advantage plans coordinate care through network of doctors, hospitals, and promoting a team approach to healthcare. We all know about the network, HMO, PPO, MSAs, private fee-for-service. These are all network-based service areas. The biggest thing is, are you within the service area? So the coordination of care is within a service area, and that could be a pro if you don't travel and just go to the same doctors, and if your doctors are in the network, that could be a pro. Prescription drug benefit. Many Medicare Advantage plans include drug coverage, so you don't have to pay for a separate standalone Part D premium or Part D drug plan. That is a pro. Those those 5 points for pros, I would say with interpretation, for the most part, they're pretty good. If you have questions about them as a con, then that's where you need to dig deeper into ChatGPT about each and every one, like the max out of pocket or the out of pocket max. It's called MOOP, max out of pocket to brokers and agents. Some of the cons for Medicare Advantage: network restrictions. Again, that's what I talked about before. Service areas, local HMOs are between 10 and 15,000. Doctors, hospitals, they could even be less than that. A regional PPO can be anywhere from 50,000. Doctors, hospitals, clinicians within that service area. A national PPO could be over 250,000. And then Medicare Part A and B is literally over 1 million, so it dwarfs any service area that Medicare Advantage has, or any Medicare Advantage plan has. So just know that when you're talking about service areas, that's Medicare Advantage. When you're talking about national coverage or having national coverage, that's original Medicare. Okay, cons: geographic limitations. Yes, again, that's service areas. I just explained that. Changing plans annually. Medicare Advantage plans can change each year, including their coverage, their provider networks, and costs. So many seniors do not like changes, but it happens each and every year with Medicare Advantage plans, and you get what's called an ANOC, an annual notice of change letter, in September for the following year for the changes that happen to your current Medicare Advantage plan. So that's why the annual enrollment period is so important in the fall, to look into those options. Number 4, potential for prior authorization. If you look on YouTube or Google it or use ChatGPT to ask about Medicare prior authorizations, you will clearly see what the news is saying about prior authorizations. And here's a article that I quickly review about prior authorizations and also improper use of prior authorization. Congressman Chris Pappas raises concern about improper use of AI by Medicare Advantage providers, and I go in depth about that and show you the video proof. And so that is a big con for if you are looking into Medicare Advantage. Okay, limited special enrollment periods. This is where I'd tell you, speak with a seasoned Medicare insurance broker. That way they know what the special enrollment periods are for your specific situation. Okay, so, and then I go on to ask a specific question about your Medicare. So most folks don't even know about this when they're transitioning on Medicare. It's called IRMA. IRMA is the extra charge on top of your Medicare Part B premium, your standard Medicare Part B premium. IRMA stands for Income Related Monthly Adjustment Amount. I've written a LinkedIn article about this since in 2018 or 2019, and it got a lot of reviews and how to appeal the IRMA charge. So if your income has adjusted, you can appeal it. Doesn't cost anything, but you will have to make sure that you send in the proper forms. So if you need more information about that, I have a video on my channel about the IRMA charge and how to appeal it and the form that you'll need. So that's the IRMA charge is is an additional cost that some Medicare beneficiaries may have to pay for Medicare Part B, which is medical insurance, and Medicare Part D, drug coverage, if their income exceeds certain thresholds. So again, the more, if you're a higher income earner, the more you make, the more you'll pay. So Here are the thresholds if you filed individually. Here are the thresholds if you filed jointly as a married couple. And then I asked what are the income limits, and I get to the cost of the extra charge cost. So the 2024, this gave me the 2023. If you need to know the 2024, you can quickly go to cms.gov and just type in 2024 Medicare Part A and B premiums and deductibles, and you can clearly see that the Medicare Part B standard premium for Medicare Part B in 2024 is $174.70, and the Medicare Part B deductible also went up to $240 from $226. So the reason why it's showing this 2023 is obviously it's the beginning of the year, January 2024, so it has not completely updated to 2024 information just yet. And so I probably should have just asked it that, and it would have given me the 2024 information. But CMS.gov is the administrator for all things that are Medicare and Medicaid, so that's a great resource. Okay, and then and I transitioned from back. So if you looked into IRMA, but you want to know the total cost, then how much does Medicare cost? And then it goes back into the standard monthly Part B premium. Again, the $174.70 is 2024. And then the Medicare, if you go the Medicare Advantage or the optional alternative, remember I said earlier, alternative, that the cost of Medicare Advantage plans can vary widely. And it can literally go from $0 to $100 national PPO Medicare Advantage. And I'm going to get into that video in the future that Medicare Advantage plans are no longer going to have that zero premium in the future. If you want to know more about that and want to just see the trend for what's going on with Medicare Advantage, stick around and I'll let you know what's going on with the companies. Okay, Medicare Part D drug coverage. Yeah, so and it goes into Medicare Part D drug coverage. Remember, Medicare Part D is associated with it being a standalone drug plan, which means it's when you're going on the original Medicare path. When you use your red, white, and blue Medicare card along with a separate Medicare Part D card, just think of it as your pharmacy card. You have a specific card for that. With Medicare Advantage, it's an all-in-one. You take it to your healthcare providers, hospitals, and your pharmacy. So Medicare Advantage seems to be an easier way because you have one ID card. With Medicare, original Medicare, you could have up to 3. You could have the red, white, and blue Medicare card. You could have your Medicare supplement that works in tandem with Medicare Part A and B for your healthcare and the hospitals and surgeries or durable medical equipment. And you have a standalone Part D, I'm trying to get in the screen here, Part D pharmacy card. So you'll have 3 ID cards. So it's a little confusing there, but once you get the hang of it, it's pretty easy because you can use it pretty much everywhere. The Medicare A and B with a supplement, and then with the Part D, you'll just have to call when you're out of network for the pharmacy. You'll just have to call your prescription drug plan. Okay. And then the Medigap, that's the Medicare supplement. That's a second ID card, or you're also known as Medicare supplement insurance in each and every state. So again, it's going to tell you these different things. You might be a little bit confused, but that's why it's such great customer service, because every time I have to explain this to beneficiaries, unfortunately, I just don't have the time to be able to explain Medicare to each and every couple, because there's 64 million of you guys in the landscape, and I just want to make sure that I'm providing value to the community and not just individual couples. I want to provide to the individual couples with these informative videos and with these hassle-free videos, because I know how much you guys are bombarded each and every day, each and every Medicare season in the fall, and then each and every Medicare Advantage open enrollment in the beginning of the year. So if this information has helped you in some way, or you want to know a different tutorial, please let me know in the comments below. I'll be making the second video of how to use ChatGPT on your smartphone. So take care, God bless. If you have a service need for Medicare supplement insurance, you can go to medicaresavings.us. If you have more questions and you want to speak to live agents in the Medicare community, go to Medicare Forum. And if you need to call me like this person, then you can call our 1-800 number or our toll-free number at Medicare Savings. So take care. God bless. Let me know if I could be of service to you. Take care.